I'm delighted to welcome so many of you from around the world to today's discussion. Our event today has been prompted by a new book on Winston Churchill and his illnesses, at a time when the health of world leaders remains a matter of great public interest, most recently from the risks of COVID-19 on to concerns about mental health. We have an excellent panel today. Our two authors, Professor Allister Vale, clinical pharmacologist and toxicologist at the University of Birmingham, and Dr. John Scadding, honorary consultant neurologist emeritus at the National Hospital for Neurology and Neurosurgery at Queen Square in London. We also have Dr. Anthony Daniels, better known to you perhaps as Dr. Theodore Dalrymple, writer and former psychiatrist, Dr. Adrian Crisp, Fellow of Churchill College, Cambridge, and Chair of the Churchill Archives Committee at Churchill College, and Dr. John Launer, General Practitioner, who has just reviewed the book for the Postgraduate Medical Journal. There's much more on our website about our panel. This session has been organised by Medical Society, the Fellowship of Postgraduate Medicine, and Healthy Heart Charity, the Cardiovascular Research Trust, both of which I chair. Churchill's illnesses range from concussion and fractures to pneumonia, atrial fibrillation, suspected heart attack and strokes, many occurring at times when his decisions would play a key role in national and world events. Some of the obvious questions for today include, why should we be interested in the health of world leaders? Why discuss Churchill's health now, over 6 decades since his last role as leader? And what do we know about Churchill and his health, and how has a new book changed what we know and think about Churchill? Our aim is certainly not to reduce an outstanding, complex leader to a case study within a series of illnesses. We shall now turn to Allister Vale, who will discuss some background to the book, including the search for new sources and an outline of some of Churchill's key medical advisors.
The title of our presentation is borrowed from Martin Gilbert's excellent book, In Search of Churchill, which describes his decades-long quest to write the definitive biography. Although much has already been written about Churchill's health, little has been published that is evidence-based. In order to write the definitive account, by providing a description and analysis of Churchill's major illnesses, we required access to all his medical notes. Against a background of a lifelong interest in Churchill, I will now describe our search to identify these sources of medical information. Step one was to identify all the doctors and nurses who had treated Churchill. Lord Moran's book, The Struggle for Survival, was used as a starting point. However, it soon became apparent that many of the clinicians who treated Churchill were either not mentioned or given little prominence by him. Step two was far more difficult. This involved multiple attempts to find the families of the doctors and nurses concerned, in the hope that they still had case notes in their possession relating to Churchill. Step three involved approaching archivists at Royal Colleges and the Wellcome Library with both general and specific requests. When found, we discovered the clinical notes were often closed for perusal and most certainly for publication. We were fortunate to have the support of the Churchill family in having these closed archives open for our use. In the end, all known archives were open to us and publication was allowed. Thus, we based our description of Churchill's illnesses on a large number of new sources. Churchill's parents, Lord and Lady Randolph Churchill, were able to engage doctors of reputation and skill, often at considerable cost. Later, following Churchill's distinguished military career and his establishment as a major figure in British political life, any doctor invited to see him did so without question. We're not aware of any doctor declining to see Churchill. Almost all did not charge a fee. Many of the doctors involved in Churchill's care kept detailed clinical records. A few also included comments about Churchill's reaction to his illnesses. We have included these comments in our book because they help provide a rich picture of Churchill, his fears, frustration at being ill, his insights, his request for detailed medical information, his supreme intelligence, and his enduring wit. But above all, Churchill's reaction to serious illness demonstrated his courage, resilience, sense of duty, and determination to continue serving in high office. This is best shown by his ability to continue during many stroke episodes. We believe this to be truly remarkable, which is why the subtitle of our book is Courage, Resilience, Determination. The care that Churchill received from more than 30 eminent physicians and surgeons and from the carefully chosen nursing staff was exemplary. We will now discuss 4 of them. Lord Moran had become Churchill's principal physician in May 1940 and remained in this role until Churchill's death in January 1965. Moran devoted himself to Churchill's care, travelling with him during the war and on most of his subsequent foreign travels, and was virtually always available at short notice for consultation when Churchill was in Britain. Moran, already a senior and distinguished physician in 1940, could call on any opinion he felt necessary, to Churchill's great advantage. Moran decided to publish his book, The Struggle for Survival, in 1966, shortly after Churchill's death. The book was published in the face of Lady Churchill's objection, though Moran claimed to have received Churchill's permission to write his book. Later editions of Moran's book clarify that it was not based on an actual diary, but rather notes jotted down at the time, interspersed with non-contemporaneous essay material, which has led understandably to misleading impressions. Although Jamie Wilson, the present Lord Moran, generously gave us complete access to the closed archive at the Wellcome Library, including multiple versions of Struggle for Survival, we have drawn on all other available resources in writing about Churchill's illnesses. But Moran was not Churchill's first principal physician. From 1936 until 1940, Churchill often consulted Dr. Thomas Hunt. One day, the future Prime Minister rang up asking for an appointment at 4:30. Hunt was quite firm. He had another patient at that time. Churchill was nettled and chose an alternative physician. Nonetheless, Moran invited Hunt to see Churchill again, which he did on several occasions between 1958 and 1960. The medical records show that Churchill consulted Hunt regularly about his chronic indigestion and acid regurgitation, which had been present since 1912. Sir John Parkinson was appointed physician to the London Hospital in 1927. With Evan Bedford, another of Churchill's physicians, he correlated the symptoms and electrocardiographic signs of myocardial infarction in 1928. This understanding was crucial when he was asked by Moran to see Churchill on his return from Washington in February 1942, after he'd suffered an episode of chest pain in the White House. Parkinson's clinical notes and electrocardiograms make clear that Churchill did not suffer a heart attack while staying in the White House for Christmas, contrary to what Moran had written in his book. Lord Brain was the preeminent neurologist of his generation. He was involved closely in the assessment and management of Churchill's cerebrovascular disease. With the permission of his son, Michael Brain, himself a physician, we have made many references to the case notes of his encounters with Churchill from 1949 to 1956. It is clear that while Moran had great respect for Brain's opinion and expertise, The two men did not always get along well at a personal level. We have provided evidence of a strained relationship at times over many years between the two men. Brain succeeded Moran as president of the Royal College of Physicians. A page from Brain's handwritten notes is shown. In writing our book, we adopted a rigorous, evidence-based approach throughout. We accessed all existing published sources and identified a wide range of new sources. These sources were amalgamated with the contemporaneous documented observations of his family, friends, and other political leaders. We hope you enjoy the book as much as we did in writing it. More information is available on the book's website. John Launer has published an extensive review of our book in the February issue of the Postgraduate Medical Journal. We encourage you to read it. A full list of acknowledgements relating to the sources and images used in this presentation may be found in our book. All are copyrighted and may not be used without the permission of the copyright holder.
Thank you, Allister. You mentioned that the book has been reviewed by Dr. John Launer for the Postgraduate Medical Journal. John, can I turn to you now for your reflections as a general practitioner, but also from the perspectives of your own family?
Lovely. Thank you very much indeed, Donald, and thank you for inviting me to join this panel. I guess I need to start by saying I have absolutely no credentials whatsoever as a Churchill historian. I was asked by Professor Bernard Chung to review the book for the Postgraduate Medical Journal, as you say, and in fact the link to the review was posted about an hour ago, so it is now available for anybody who wants to look for it. I opened my review with a family memory which was of Churchill's funeral, and I think almost anybody of my generation would remember that. And I recalled when the funeral finished and the national anthem was played, my parents, who were refugees who had served in the Royal Air Force, actually stood to attention. We stood to attention in our living room. Not an unusual thing to do at the time, although it would be something most extraordinary, probably unimaginable for most younger people today, but it really symbolizes the reverence and awe in which Churchill was held. Of course, reading histories written since then, one has a far more nuanced picture of Churchill, thinking of the whole length of his career, his opposition to women's suffrage, his opposition to Indian independence, and some rather dark episodes, including Gallipoli. So one has a rather more complex view of Churchill nowadays than we had at the time of his funeral. But reading the book, I was absolutely enthralled. The only medical facts that I was familiar with about Churchill before I read the book were, of course, the myths that he was alcoholic and that he suffered from severe depression, which the authors, I think, deal with very, very fairly and in a very measured and balanced way in the book, as indeed they address Churchill's illnesses throughout the book. And one of the best features of the book, as far as I was concerned, and I've written one biography myself in the past and used the same approach, so particularly liked it, was to use an entirely documentary approach, that the book is a quilt written around documents taken from diaries, correspondence, memoirs, and obviously medical records. And the advantage of that is that the authors allow readers to form their own medical views and judgments and perspectives. And where they give their own views, they do so with a very light touch and not in a dogmatic way. And I really appreciated that. I think it also creates an extraordinary image of a man who, as Lord Moran said, had 9 lives, or many more than 9 lives. In fact, he survived, as you will read in the book, 4 or more episodes of pneumonia, most of which were before sulfonamides and penicillin were invented. He survived 7 or more strokes, some of which he concealed to varying degrees or altogether. He survived at least 3 life-threatening accidents, which the descriptions are all fairly hair-raising. So one gets the impression, as well as a man who suffered so much, or had extraordinary stamina and resilience, both between these episodes and also after all these episodes, in enabling him to recover and to return to his varying roles, and most especially that of Prime Minister. But I think most striking of all in the book really is a portrait of a man who is both very courageous, but also very generous, very vulnerable, very susceptible to moods, and actually an extremely likable individual. And I think in many ways the book allows one to recapture or to retain that rather pure, heroic image of Churchill that most people of my parents' generation held. And I think it's valuable for that alone, as well as for the meticulous account of his medical conditions and their treatment, and will be worth reading, I think, just for anybody who was interested in getting a sense of the individual from people who either treated him or were very close to him as family and friends. So I'd like to return Allister's compliment in recommending my review by recommending that perhaps shortly after reading the review, everybody should read the book as well. Thank you very much, Donald.
John, thank you very much indeed. Can we turn now to Dr. Tony Daniels, who's joining us from France? Tony is a former psychiatrist. Would you say a bit more about this question of black dog?
The idea that Churchill suffered from severe depression seemed to have started with an essay by Anthony Storr, who was a very, very good writer. He was, of course, a psychiatrist, and it was almost immediately accepted that Churchill suffered from severe depression, and Storr gave a kind of etiology of that depression. He seemed to me to argue from the etiology to the diagnosis rather than from the diagnosis to the etiology. And as far as I could tell, I'm not nearly as qualified to speak about this as Allister. As far as I could see, that there was no real evidence of any severe or lasting depression in his case, and certainly not a mania either. That he, of course, had different moods is undoubtedly true, but I dare say most of the people watching this also have various moods. And when you consider his life, it would be extremely surprising if he didn't have changes of mood. In fact, there would be something wrong with him if he hadn't had changes of mood. But he was extremely resilient. If you just take the episode of Gallipoli, he really thought that his career, his public career, was over as a result of that, which was a perfectly reasonable thing for him to think. But within a very short time, he was actually enjoying, if that's the word, the command of soldiers in the First World War, and he did it very well. So in other words, there is no evidence, as far as I can see, of any lasting mood change that would lead one to diagnose him as suffering from a mood disorder. And it is striking, of course, that really, as far as I'm aware, none of his medical advisors thought that too. The black dog was a kind of rather fleeting feeling of despair. And despair in his life, there were many occasions when it would have been quite reasonable for him to feel despair, particularly Gallipoli, for example, but there were many other occasions. The question, I think, which interests me, is why it should have been so quickly accepted that Churchill did suffer from a severe mood disorder, but I won't go into that now. I just think the main point is that he did not suffer from any real severe mood change which incapacitated him or which lasted for any length of time such that one would diagnose him with a psychiatric disorder.
Tony, thank you very much indeed. We may come back to some of those issues in a moment. Can I turn now briefly to Adrian Crisp, who was chair of the Churchill Archives Committee and an expert in metabolic bone disease.
So I chair the committee which helps to encourage the activities of the Churchill Archive Centre. It's the college keeping an eye on the archives, if you like. And as you may remember the background, the papers were not owned by the college, they were owned by the Churchill family. Probably 20 years ago, the nation purchased Churchill's papers from the Churchill family and deposited them in the Churchill Archive Centre. The Churchill papers are much in demand. Most of it's online, most of it's all digitized, but we still do have people visiting the Archive Centre. There was not within the book a clear diagnosis of osteoporosis, but I think the circumstantial evidence for that diagnosis is very strong. For example, he had a number of important risk factors for osteoporosis. He was quite a regular, consistent consumer of alcohol, which probably in men is the commonest cause of osteoporosis. He was also a smoker, which also is considered to be an important risk factor. And of course, he was a man of advancing years, and age is another obvious typical risk factor for the disease of osteoporosis. But what made it more convincing for me is that he fell and sustained multiple vertebral body fractures, which is a very typical presentation for osteoporosis. He later suffered a fracture of his hip, which again is a classical feature of osteoporosis. And those two factors alone would make me very clearly make a diagnosis, although one would want to back that up with appropriate radiology, scanning, bone densitometry, and much of that, of course, was not available during Churchill's lifetime. They were really relying on plain X-rays, and I understand some of those might be available somewhere, but they're not easily available. So I, for my part, having spent a large part of my career working in osteoporosis and related bone diseases, I would see him as a prime candidate for that diagnosis. In practice, changing lifestyle does not really have a major effect in the treatment of osteoporosis. We're very much reliant on effective drugs, and it's very important to note that during Churchill's lifetime, there were no effective drugs for the treatment of osteoporosis. So he didn't miss out on having effective and specific treatment.
Well, Adrian, thank you very much indeed for those comments on the Churchill Archive, but also on this question of bone disease and what might have happened. And can I turn now to John Scadding? John, would you say something about Churchill and his strokes? I mean, there's some obvious questions, John, why he might have had them, what you could have done about them in those days, and also what impact there might have been for having the strokes on his role as a major leader of the time.
Thank you very much, Donald. Between August 1949, when Churchill was 74, and his death in January 1965, Churchill had 7 strokes and 2 transient ischemic attacks. These included 3 left cerebral hemisphere episodes, 3 right cerebral hemisphere episodes, an ataxic stroke, possibly of cerebellar origin, possibly a deep capsular lesion, a visual transient ischemic attack, and a transient ischemic attack involving dysphasia, so in the left cerebral hemisphere. And for the reasons we've argued in the book, it's likely that these resulted from small vessel disease. They were all of acute onset, one of stuttering onset, usually quite rapid improvement, and though a bit slow in some episodes. These were associated with a much later gradual development of a certain degree of cognitive impairment. Well, now the medical context, I think, is worth looking at the time that this was all happening. The first is that there was no non-invasive imaging available, no CT, no MRI, and even carotid ultrasound was in the future. There was an incomplete recognition of the importance of atrial fibrillation in the causation of stroke. Normal blood pressure values were higher then than they would be accepted as being normal now. There was limited understanding of the association of hyperlipidemia in the causation of vascular disease. The importance of smoking in vascular disease wasn't recognized until the mid to late 1950s. As for obesity, diet, and exercise, these were really only fully understood after Churchill's death. As for work-life balance, the term, of course, is very modern, and I don't think Churchill would have given it a jot of recognition. And of course, there were no specific stroke treatments. So against that background, in 1949, when Churchill had his first stroke, what were our very distinguished patients' risk factors that we would recognize now? The first was his age, of course, 74. The second was that he was definitely somewhat overweight. He was a cigar smoker, but never, I think, a cigarette smoker. A steady alcohol consumption, and we may come back to that in discussion, I dare say. A very rich diet, no question about that. He took very little regular exercise. Swimming in the Mediterranean was a favorite pastime. He worked excessively long hours and many late nights. There was a history of inappropriate therapeutic drug usage, which included amphetamines, which again we may come back to, and barbiturates. His blood pressure was borderline raised, and he had some episodes of atrial fibrillation, though these were always short-lived. So against that background, I think it's fair to say, and without going into all the details, because that's in the book, at least 2 of the strokes that Churchill suffered would have been sufficient to cause a man of his age to retire, but not Churchill. I mean, he was courageous, resilient, determined, and had a sense of duty and sheer bloody mindedness. I think that's underestimated, which drove him on. Now, the pattern of the cerebrovascular disease we could dwell on, small vessel disease, but I'm not going to at this time, but I'm happy to come back to it in discussion. Moran referred to it frequently as arterial spasm. That's a concept that we would not recognize as being important as relevant in these days. And the pattern of small vessel diseases is recognized now as being due to occlusion of lenticular striate branches of the middle cerebral artery. And again, we can come back to that if anybody wants to question me further about it. There was no specific treatment for stroke, and it's notable that Lord Brain was only asked to see Churchill often at some interval following the acute onset, because there was nothing that could be done. Even low-dose aspirin, of course, was a thing well into the future at that time. Now, of course, there's been much speculation about Churchill's ability to continue to govern and to be in a seat of power during these episodes. And it was following his left hemisphere transient ischemic attack, which led to dysphasia in February 1952, when he was 77, that there was an interesting discussion between Lord Moran, John Colville, Joint Principal Private Secretary, Sir Alan Lascelles, Private Secretary to the Queen, and Lord Salisbury, who was Lord President of the Council. Lascelles said, "Well, listening to what you have told me, I would say at once that the Prime Minister ought to resign and be content to be the elder statesman in the Common or the Lords. Better perhaps in the Lords. I have been expecting for some time to see you in this room. It is true that sometimes the Prime Minister is all on the spot, and I say to myself, why am I worrying? But at other times, he doesn't seem able to see the point of a discussion." Well, Churchill and Moran had a discussion shortly after that, 3 or 4 days afterwards, and Churchill said, "I knew something had happened when I could not get my words on the telephone. I didn't like it. I was frightened." "Oh, not frightened of anything, but I'm all right now. Why couldn't you tell me by examining that anything had happened?" "But the fact remains," said Moran, "that you've had notice to go slower." Churchill, "I don't mind dying in harness." And on the next day, Churchill responded in the House to Herbert Morrison's speech, which was a vote of censure. And Gilbert, Churchill's biographer, said, writing in 1988, on February the 26th, the powers of recuperation and the extraordinary determination of this man of 77 were made abundantly clear to those who had known of his arterial spasm and discussed how to send him to the Lords. For it was only 5 days after the attack that Churchill spoke in the House of Commons on foreign affairs. Well, I've just quoted some of the remarkable things that were said of Churchill. Of course, in June 1953, within 24 hours of suffering a left hemiparesis, he chaired a meeting of cabinet, and nobody noticed. No one noticed. So I think Churchill recognized that he was becoming ill. He recognized his own diminishing cognitive powers, but when he was fired up, he could continue to perform. And I think this raises questions about his determination, and what I would like to call cerebral reserve, not perhaps a very popular concept in neurology, but here was a man with remarkable powers who could lose quite a lot of what he had and still function at the highest level.
John, thank you very much indeed. Just to pick up on one or two points before we turn to Allister to comment on the medicines aspect of Churchill and his treatment. A couple of comments here from Claire Gorrow, who's contacting us from Vermont. Claire makes a comment, difficult to answer whether this is true or not, whether Churchill's powers of recovery say something about a very good ability to generate collateral circulation in the brain. I'm not sure whether there's anything more you can say, then take that as a comment. Secondly, given in the book there's reference to atrial fibrillation, which is known to be a source of emboli from the heart to cause strokes, whether that might have been a reason for his recurrent strokes. But the third, which you might be able to address directly, is whether or not there's a link between his degree of alcohol intake and an amount of anticoagulation, that's to say, protecting him in some way from more severe strokes than otherwise might have happened.
Yes. Let me answer the second one first. The alcohol is more difficult than the atrial fibrillation. The atrial fibrillation, the fact is that he was only noted to have very transient episodes of atrial fibrillation. And there are many occasions when his pulse was clearly taken and it was not remarked that he was in atrial fibrillation. So I think the atrial fibrillation is a red herring in relation to his cerebrovascular episodes. The second is that small vessel disease is, of course, mainly due to occlusion in situ rather than embolic disease, although it's very difficult to be absolutely certain about that. So I think that his recurrent episodes of his cerebrovascular episodes were due to thrombosis in situ rather than being due to embolic disease. But of course, that's arguable. There were limited investigations available at the time and so forth. Now, as to the alcohol, that's difficult. I mean, Churchill imbibed all the time. I spoke with, and when Allister and I presented at the Royal Society of Medicine over a year ago, we heard from Lady Williams, formerly Jane Portal, who was, of course, one of Churchill's private secretaries. And she described to us that in the morning, he had his mouthwash, and that was a tumbler with a little bit of whiskey and a lot of water, and he sipped this all day long. So there was always some intake of alcohol, and indeed Churchill was well aware of his reputation, and indeed of the fact that that people were concerned about his alcohol intake. And I'll give you two quotes, if I may. "I neither want it (brackets brandy) nor need it, but I should think it pretty hazardous to interfere with the ineradicable habit of a lifetime." And the other one is to his wife, "Always remember, Clemmy, that I have taken more out of alcohol than alcohol has taken out of me."
Thank you very much, John. Can we turn now to our other author, Allister Vale? Allister, could you comment on two aspects of the medicines? There are many things we could go into, but firstly, interesting potential observation you made in the book that perhaps some of Churchill's illnesses might have been medicine-induced?
Perhaps two aspects there, Donald. But before I answer that question, perhaps I can go back to an earlier question that John was answering. Conventional liver tests were always normal. Admittedly, we don't have a gamma GT activity, but other liver tests were normal. As regards the drugs that he was prescribed and drug-induced disease, then this may have happened on 2, possibly 3 occasions. Once with a sulfonamide and once when he was prescribed an anticoagulant, Dindivan. Perhaps a greater concern from a medicine point of view is the fact that Warren prescribed barbiturates as night sedation over many years, and this may well have contributed to his falls later in life. He also, as John has hinted, prescribed tiny doses of amphetamines post-stroke and controlled it very carefully so that he only got it when he was giving a major speech. And that seemed to benefit Churchill substantially, and observers who knew about this also were very impressed with the value of these small doses of amphetamine. He was also receiving aspirin, interestingly, at the same time in small doses, but probably an appropriate dose of about 75 milligrams in a combination tablet called APC, which was regularly prescribed.
Thank you very much, Allister. Could I just stay with this question of amphetamines briefly? And Tony, I'm aware, for example, that it is documented that Anthony Eden used these regularly on prescription from his advisor, and that, say, Kennedy and others did. And it's quite possible that in inappropriate doses, you certainly get habituation. Inappropriate doses, you may have had some effect on decisions and mood because of that. So it's a transient, medically induced problem rather than some sort of endogenous condition. What are your thoughts on whether there may have been times when Churchill might have had moments of crisis, may have been prescribed the major amphetamines, and that might have caused problems? Tony, do you want to comment?
Well, I would just say that I think in order to say that, you would want to know that there were problems that were consistent. First, you say what the problems are, and then you say that there's this relationship with amphetamines. And I'm not aware that there were any such problems. And in fact, they seem to do him good, as Allister suggested. Whether it was for the good of the country is another question, but that's for the historians to decide.
Well, he was definitely fired up, and I think that there may have been quite a powerful placebo effect of a very small dose of amphetamine that he took prior to some of the big occasions. But we know, and Anthony will correct me if I'm wrong here, that amphetamines can impair judgment. They can make the recipient feel that they're doing well, but in fact they're performing poorly. And everything about Churchill and his speeches at critical moments, when supported, as it were, by small doses of amphetamine, argues against that.
Yes, I mean, one has to remember that in those days, amphetamines were very widely used, and they were used very widely during the war for pilots and so on to prolong their performance.
I mean, to ask a naive question, and taking Churchill's life in 2 phases, the Second World War period, and then later when he was Prime Minister again in the 50s, thinking about the wartime, it's clear if people have bad pneumonia, they may be confused, hypoxic, not able to focus. And you're very good in the book at associating illnesses that happened and where Churchill was at the time, but also some comments from his advisors. So it's not the purpose of your book to look at the politics of the matter in detail, but would you want to comment, Allister, or anybody in the panel, about whether you think, particularly the pneumonia episodes, the more serious infections may have influenced important decisions, important events going on in the war theatres?
Yes, that's a very good question, Donald. And I think it's possible to answer it because we know about the daily output and Churchill's comments on papers that were being written by others, though of course he wrote many himself, even during periods of severe illness. And there was an occasional day when he was unable to perform like that. But those were very rare during the 3 episodes of pneumonia, for example, that he had in 1943 and 1944. And he kept the war going and his output maintained in a most remarkable way. And because we have the annotations and the corrections on the original documents, we know that he must have been still at the top of his game to be able to do that, despite his fever. Though sometimes he was a bit tough with colleagues when his temperature was very high, and they recorded that information. But he didn't seem to affect his ability to compose or rewrite documents, though he could be a bit ratty.
Coming back to the chat line, there's the question again about amphetamines from our delegate from Vermont. Her comment is she's worked as a prison doctor and has noted, this may be association, but noted that those who are known to be amphetamine abusers had the worst care she'd ever seen. I wonder whether there's any comment that you can make on Churchill's dental health.
Yes, there's lots of information on that, and he saw dentists frequently, and the archive can give you all the information, including the bills from his dentist. This was not a problem. Let me stress, he was given amphetamines by Moran very occasionally, every few weeks, every few months. This is not a daily event. In fact, at the time, as others have said, and I want to stress, virtually everyone, including consultant medics at the time, were on barbiturates at night in similar doses. And they were also taking amphetamines. I observed that myself. I mean, these were frequently available. So this was nothing exceptional, except in the sense that Churchill took amphetamines because they had to be prescribed and given to him rather less frequently than the average senior medic at the time, I would suggest.
And certainly historically, they were used as a matter of routine in the early days of dialysis to stay awake during the long periods to make sure there weren't issues with the devices. Coming to modern times, there's been recent heated discussion about the 25th Amendment to the US Constitution following the events at Capitol Hill and concerns about the ex-president. And that, I understand, arose from the time of Eisenhower, when he, as leader, had concerns about his own health and what about the succession. He took it to Congress, nothing happened at the time, but it makes you wonder, to what extent did Churchill show insight? I mean, he clearly was very ebullient and determined to keep going, but did he show insight as there may be an issue and thinking about succession?
Well, they discussed it with Eden, Anthony Eden, repeatedly. Eden was clearly keen to take over, and Churchill was not at all keen to hand over to him, even though he'd promised that he'd go by a particular date. When the date arrived, he was still keen to continue. And Churchill was saved, I think, by Anthony Eden's own illness, so that he was able to carry on. And the fact that Eden required 1 or 2 operations, which were not very successfully undertaken, meant that Churchill could continue for as long as he wanted.
Yes, I'd suggest that Churchill did have insight, but he teased Lord Moran over this. In March 1952, Churchill told Moran, and this is as reported by Moran, "I have noticed a decline in mental and physical vigor. I require prodding to mental effort. I get a good deal of prodding. I forget names. I might even forget yours, people whose names I know as well as my own. I'm as quick at repartee in the house as I ever was. I enjoy questions there. Do you think I ought to see Brain?" And Moran replied, "No use in seeing Brain unless you take his advice." I think Churchill, he had a lot of insight, but he was determined to hang on, and he knew he could. And I think that remark about enjoying questions in the house, of course, he was the quickest on his feet of anyone. He'd got the repartee. he could just beat anyone, even when he recognized that his own cognitive powers were declining.
Thank you, John. We have a comment now from one of our audience, a historian, Jill Bennett.
Yes, thank you very much. And I thank you all for the most interesting insights into Churchill. I stress I have no medical qualifications at all, but I have written about Churchill and indeed about the times of Churchill, so I have a particular interest. I think you're absolutely right about the succession. He was determined to hold on, and indeed, a lot of people felt he held on for too long. What I'm interested in your views on really is the extent to which you think he was really aware of his medical problems. Now, obviously, he was determined to soldier on, and as you rightly say, he had tremendous resilience and the ability to let, if you like, adrenaline carry him on. He responded well to challenges. And I would say that looking more after that, if you look at Margaret Thatcher, actually another leader who was, I'm not saying she had the same medical problems as Churchill, but who had tremendous ability to carry on with very little sleep. And even when she wasn't feeling well, or was tired, or things were going very badly, just could rise to the occasion. There are some interesting, but when you speak about the array of conditions that Churchill suffered, was he aware that he'd had 7 strokes, for example? Was he aware, was he actually informed by his various medical advisors exactly what had happened to him? Thank you.
Yes, well, John could talk about stroke recovery. I can say that he was aware very clearly of each episode and fought very hard, even against the advice of Moran and at times Brain, over his rehabilitation, which he largely carried out himself. I mean, the determination was absolutely magnificent. One time when he forced himself to cross the pond in his garden, he took with him a cabinet colleague into the water in an attempt to try and walk again, which clearly indicates his tremendous courage and resilience in fighting the stroke so hard. It's also true to say that, for example, when he had the chest pain episode in Washington, which Moran suggested was a heart attack, which it wasn't, and Moran knew it wasn't, but there we go. He was concerned for a few days after about his heart. The war was on, and his mind was focused on that, and the heart was not really mentioned subsequently. So when he had these episodes, it's clear that he was aware of what had happened, but as soon as he was back on his feet again, he was winning the war.
Allister, can I ask you something?
Yes.
Do you think that there is any general lesson in this, or are we dealing just with a remarkable person who, the like of whom we are not likely to see again?
I think rehabilitation from stroke tends to be nowadays organized in a very careful way. If Churchill had been offered support from a physiotherapist and others, I think he would have rejected it because he had his own clear plan to get back on his feet, back in the office as rapidly as possible.
As far as recovery from stroke is concerned, yes, he was highly motivated. Yes, Allister, he almost certainly would have taken any physiotherapist to task, and as he did with all his medical attendants. And whilst on the one hand he could be very sweet and kind to his medical attendants, on occasions he could be quite combative. He had very clear ideas of his own. And I think it's all about motivation. Yes, I think he knew exactly what was going on. And indeed, the evidence, all the evidence suggests that he made very careful inquiries and very detailed inquiries of Moran and all the other people looking after him as to exactly what was going on, because he wanted to look ahead. He needed to know in what way the illness affecting him at the time would persist, and so on and so forth. I mean, I of course have the advantage of having spoken to my late father, who looked after Churchill briefly, was involved in Churchill's care in Carthage in 1943. And he was very inquiring then of exactly what was going on. So I think it's all, Jill, about very, very strong motivation, and Churchill's incredibly strong motivation, and he felt he was the person to be in charge. There's no question about that. I mean, there are some modern day leaders who we're now quite happy just to have seen the back of, if I can put it like that, who also felt that that they should be in charge. But I think that most people would have agreed with Churchill.
Adrian, can I come back to you on this question of bone disease? And we've heard from Allister that the liver function tests, the liver tests that were done, didn't seem to show anything to suggest enough, in him, at least enough alcohol to cause detectable liver disease without the modern enzyme you mentioned, the gamma GT, Allister. So, and we also hear that he was a cigar smoker rather.
Just to say, back in the 1950s and 1960s, the diagnosis of osteoporosis was almost unrecognized. It was just considered to be a normal aging phenomenon that old people developed fractures and lost height and ran into those sorts of problems. So the fact that his advisors were not making a clear diagnosis at that stage doesn't bother me. It was just considered to be a normal aging phenomenon. But we know that in terms of risk factor, even quite modest doses of alcohol do have a pretty strong effect on the bone osteoblast, which is the main bone forming cell. They're pretty sensitive to alcohol, perhaps even at a lower dose than in actual liver disease. So the fact he had normal liver function tests wouldn't put me off that as a factor. This question about cigar smoking rather than cigarettes, I mean, I delved into this some years ago. I'm clearly not up to date now. The fact there is almost no evidence for cigars, it's because it's never been studied. There's never been enough cigar smokers to follow and find out whether they get lung cancer or any other smoking-related disease. So it's an absence of evidence, really. But from my own mind, I wouldn't see a great difference between very fat cigars daily, or even several times a day, to cigarettes, probably equally toxic. I'm not aware of anyone in his family, from that I've heard of, who had osteoporosis. It's a little footnote in his medical history, and I see it as having no influence on performance as a politician or statesman. It's just...
I mean, I think what's very interesting, I think, about Churchill and his illness is he's not unique. As we heard earlier, many of our leaders have had problems. What's remarkable in a way is how people have entered office with serious conditions, have had mental health or physical disorders while in office, and often they go on what people might think is rather far too long. It raises the question about, which has been raised by David Owen in his book In Sickness and in Power, is whether they should be something along the lines of professional footballers or heads of industry. Should there be some sort of independent medical assessment for our leaders before they enter office, so we've got some idea what we're getting? Any thoughts on that from our panel?
Does that include an assessment of mental health then, Donald?
I'd have thought so, yes. Well, yes. I say the word independent carefully, because we have, for example, Trump, who says, I have had my annual review and it's been wonderful, and nobody's there to say different. You need to have something where you could guarantee that it was done properly, mental and physical, and then there was some formal way to do it independently to make sure that any bad news was dealt with properly in the right way.
I would be very hesitant about mental health assessments because they are so open to abuse. And if you remember Senator Goldwater during the election in 1964, I think it was, several, I think about 2,000 psychiatrists, or I didn't know there were 2,000 psychiatrists, signed a letter saying that he was unfit for office on mental health grounds, and he clearly wasn't. I mean, you might not like him, but he was not unfit in any obvious way. And in fact, with regard to Donald Trump, there was a book published about the time of his election by a psychiatrist called Dr. Bandy Lee, and was written by so-called specialists in mental health, which told us nothing really about Donald Trump that wasn't obvious to anybody who just watched him on television. But they would have liked to have had men in white coats cart him away. It subsequently turned out that Dr. Bandy Lee herself was a bit peculiar, because she said that, I think she said that at least Hitler did something for his people, in contrast to Trump. So I think there is a great danger there.
Well, of course, the other resonance is Soviet times and using psychiatric problems as a way to get rid of unwelcome rivals. But what about the medical side of checking and what would be deemed nowadays to be some condition that you would think would worry you about a leader?
Well, I think one would expect that somebody coming through the system, as it were, in this country would have had to have faced parliamentary time, questions, so on and so forth, and that would have had to have worked their way up through, and they would have been, as it were, weeded out by a sort of process of natural political selection. I think the situation in relation to North America, and since Trump has been brought up, it's different, because there in that system somebody can become president without ever having held elected politically held office before. The other comment I would make is that personality disorders are not generally counted as, and Anthony will correct me if I'm wrong, not generally counted as disorders which discount one from political office or anything else.
Well, there is a bit of confusion here, because sometimes in courts, for example, they are used as mitigating circumstances, and sometimes not. And the courts themselves can't make up their minds as to whether they are or not. So it's difficult. But if you take someone like Trump, I think what he was like was absolutely obvious. It's been obvious for years and years. And I don't think psychiatrists have anything to offer in a case like that.
Yeah, well, I think, Anthony, if I may venture now, I'm probably going to incur the wrath of some people on this cast, that narcissistic personality disorder did not seem to disbar him from holding that high office.
So John Launer, as a GP, you must have seen many patients where you were asked to give occupational health guidance. And in modern times,
yes,
you're careful about what you consider not to be a condition where people are not going to be able to function.
I tend to agree with what everyone has said with regard to the problems of mental health diagnosis and medical diagnosis in relation to leaders. But I think I would make a distinction with regard to cognitive function. I think there are good enough tests of cognitive function that one could actually declare that somebody's mental capacity had deteriorated enough that they were no longer able to think clearly enough to make decisions. I think particularly in the context, and one thinks of the sort of terrifying prospect of Donald Trump being tempted to use nuclear weapons in the last days or weeks of his administration. I think if there had been a genuine grounds for calling his cognitive function into question because of any signs of dementia and so on, I think there would be a very good case for having some sort of tribunal or independent system with the ability to take that to the Senate and have him removed.
Of course, there are concerns about Mr. Biden as well.
Indeed, and I would support an independent tribunal in those circumstances, regardless of the kind of political allegiance of the person themselves.
I think, as speaking as a neurologist, and of course I'm no longer in clinical practice, but of course I was called upon quite frequently to, as it were, adjudicate on matters of cognitive impairment and ability to continue in the role. And I of course can recall cases from a bishop to somebody working on a nuclear submarine, where there was clear indication to say, no, they must be removed from these offices. But I think in relation to the people we've been talking about, certainly in relation to Trump, it's who he was, who he is, and he'll never change.
Thank you, John. We're just coming to the end of our session. And for our panel, can we just go around the panel just to see if there's any final comments or thoughts? Adrian, anything you wanted to add?
I'm most interested in Antony's account of Churchill and that side of things. I always wonder whether one should attribute more significance to his loss of his daughter back in the 1920s. He lost a small daughter. And this had a profound effect on both Churchill and Clementine, which doesn't really sort of fit in, but that early loss, which was so deep to him, I think might have scarred him mentally. Again, I think it's another explanation for his plunge in spirits at various times. But I thought that was something worth bringing out.
Thank you very much, Adrian. John Launer?
I'd just like to quote from a beautiful quotation that's in Allister and John's book that comes from somebody who knew him well. It said of Churchill, he's emotional. I think the right description is that he allows himself to react fully and without restraint and without troubling himself about what impression he makes on the onlookers. He is no actor, no poseur. I thought that captured his personality wonderfully.
Thank you, John. And John Scadding, final thoughts?
Yes, just to follow on from that, exactly right, John. And I think that Churchill, he was suspected of being emotionally labile in a pathological way. I don't think he was. I think he had very, very deep-rooted emotions which were rested in reality. And he had normal cyclothymia, if that's the right term, Anthony, and to our great advantage.
Thank you, John. And you, Allister, final thoughts?
Yes, he was very tearful quite often, but this wasn't associated, I think, with any dramatic change in his emotional state. Sometimes when he heard some news, he would tear up transiently and then carry on quite normally. And that was generally accepted as a fairly frequent phenomenon by those who were around him.
If I might just say something, we ended by saying he was exceptional but normal.
Yes, yes.
Well, thank you all. To close, I'd like to thank our audience for joining us from around the world. And finally, many thanks to our panel, Allister Vale, John Scadding, Anthony Daniels, John Launer, and Adrian Crisp. Thank you all very much indeed.